Everyone falls from time to time, but injury from falls and slips, especially in the elderly or disabled, cannot always be avoided. However, the risk can be reduced. Before we look at what to do if you fall, let's look at what can cause you to fall. People are at a higher risk of falling if they have had a fall in the past 12 months. Balance or ear problems, fear of falling, or mental health problems. Medicines can increase your risk since there may be side effects relating to sight, balance, or dizziness, and it may make you feel lightheaded. Your doctor or pharmacist can give advice on possible side effects of medications and the best time to take your medications, as some will need to be taken with food or at night. Taking them at the wrong time may cause you to feel unwell. Make sure your doctor reviews your medications at least every 6 months. Ensure that you eat a regular healthy diet, as lower sugar levels can cause dizziness. Your doctor's surgery can advise a diet or put you in touch with someone who can help. Make sure you wear your glasses or hearing aids if you have them, and make sure your home is well lit so you can see where you're going and hear any possible dangers. You can get free eye tests and hearing tests. There are also some opticians that can test your eyes at home. If you have pets, make sure you know where they are, and if they have toys, try and keep them tidy. A dog can leave dribble or urine on the floor, and this could cause a slip hazard. Your footwear is important in reducing slips and falls. Make sure your footwear is in good conditions and the soles are not broken. Shoes should fit correctly and have a good grip and effective fasteners to keep them in place. If your shoes are not done up or there are loose shoelaces, this can easily trip you. Avoid just wearing socks, as these can cause you to slip, and you can easily stub your toes if you're wearing socks or barefoot. If you do not have shoes or slippers to wear, barefoot is better than just wearing socks, since you'll have more grip on bare feet. Clothing can also cause problems, since badly fitting clothes that are too long can trip you up as you walk. Loose clothing can also get caught on door handles, which will pull you over as well. Loose rugs, mats and damaged carpets can trip you, as well as cables and other items on the floor. Take care when you're going to the toilet, especially at night. Make sure you turn the lights on and use handles to keep yourself safe. If you're using mobility aids, make sure they're in good working order and they've been adjusted in size for you. Walking sticks, crutches and frames must be maintained and have effective rubbers on the ends. The rubber should be checked daily, and sometimes the stick can cut through the rubber and you may push down on bare metal rather than a non-slip rubber. Your doctor or hospital can advise on where you can go for help and advice. If you do fall, the first thing to do is try not to panic. Relax and think about what you need to do rather than get up quickly. You need to know why you fell and avoid it happening again. Attempt to get up by rolling onto your hands and then crawling on your knees and crawl forward to a piece of furniture and pull yourself up. If you're unable to get up, get help by using your emergency pendant or shout for help. Use call bells or phone someone if possible. If this is not possible, try and keep warm and move as much as you can. Try and use cushions and be as comfortable as possible until help arrives. If you pass urine while on the floor, try to move away from the wet area and use newspapers or magazines to absorb the fluid. A lot of what we have covered is common sense, but if you aren't careful and rush, you can easily fall. Make sure you tell someone if you do fall or feel dizzy at times, as they can help you to remove the risks or help you get medication to feel better.